other thing that you want to assess is you want to make sure that there is a real need for this. So I always tell people make sure you do a little bit of research on what niche you want to get into. How big of is it a problem in your area? How many specialists are in your area for that exact thing? I do want to say that this research kind of throws people off a little bit because sometimes they'll see, oh, there's already two or three specialists in my area. Well, I can't get into that. Well, that's crazy. There's tons of people that have this problem, and if you research kind of who has a problem, how many people have this problem, and start talking to maybe healthcare professionals that are in this area, maybe you go find one of those specialists and say, just, can you mind if I talk to you or interview you? Or, hey, how big of a problem is that you're seeing this? So sometimes you can use other healthcare professionals to give you some insight on is it a big enough problem, and if they've got a good flow of patients and good flow of people, then it's probably going to be no different for you. And sometimes you can even be a niche within a niche. You could be, maybe they do. I'm at one of our specialties, or my specialty clinic is our head, neck, and face pain patients. So there are dentist specialists. We're the only physical therapy head, neck, and face specialty clinic anywhere in our county. So we're definitely there. But the reality is, if you go Google TMJ, there's going to be dentists in my area that treat it. So they treat it differently with splints. Well, I don't do splints. I'm not a physical therapist by trade, and so I make sure that I differentiate myself in what I can do for those people. Doesn't mean we can't have the same population, but what makes me different? What techniques do I use versus someone else? So